back to the Bronx Journal. I'm your guest host, Heather Mangal. New York City has the highest rate of HIV/AIDS for young people between the ages of 13 and 24, with the largest numbers coming from the Bronx. The mission of the Montefiore Adolescent AIDS Center here in the Bronx is to serve as a resource for the youth who live with the AIDS/HIV virus. They also help those who are at risk. With us today is HIV counselor and educator from the Adolescent AIDS Center, Patricia Jackson. Welcome to the show.
Thank you for having me.
So how long have you been a counselor, and what made you decide to go into this field?
Well, it's interesting that you asked that. I was taking a course right here at Lehman College back about in '94. And Dr. Futterman, who heads the program up, came over and did a presentation, and she kind of cornered me, and I became a volunteer at the program, and needless to say, I'm still there now. I did a study for the young women through the CDC, and then I just stayed on. So it's been about 16 years now.
It must be difficult giving a positive result to an AIDS patient. Can you recall an experience where you've had to do that?
Well, telling someone that they've tested HIV positive normally would be somewhat nerve-wracking, you would think, but ultimately it is giving them a sense of life going on. It's not a death sentence. Right. The first time I had to do it, I think I was more afraid and more nerve-wracked than I thought the patient would be.
Right.
But the patient ultimately understood that they were HIV positive. It's not a death sentence. The patient is still alive. It's been about 15 years. It's usually our response to thinking that, oh my goodness, this young person is going to have to deal with something that's traumatic, where basically it's a chronic illness. So what we usually do is take them into care and monitor them quarterly. Very few patients have the reaction that you would think that they would have, where they want to commit suicide, or they think that, oh my goodness, this is the end of the world, I can't have children, I can't get married. You know, we walk through them through all of those steps. And
how do you walk them through those steps?
We have a full team at Montefiore. We have psychiatrists, social workers, I'm a health educator, we have medical providers. We give a lot of health education as to what the virus is, what it looks like in your body, what it does in your body, and the reason that you should get tested so early so we can keep you in optimum health, as opposed to waiting until you get sick and then finding out you did test HIV positive.
No, what's the process? What are the steps getting these people through?
Okay, as a young person would come into my office, normally they would call in, and okay, this is World AIDS Week.
Right. So
there's a lot of awareness. So I've gotten several calls with young people who have put themselves at risk, and when I say at risk, from unprotected sex. And that's the risk because it's the exchange of the body fluids which ultimately puts you at risk for HIV, the exposure and infection. And they'll come in for testing. It's a 20-minute test. It's a swab. I let it cook for about 20 minutes. During that time, I do a lot of work with them, assessing their risks, when they had unprotected sex, if they've had unprotected sex, what did they do other than unprotected sex, maybe tattooing, because there's a lot of household tattooing now. We don't see a lot of injection drug use in the young population here in the Bronx. There is some drug use and hormone sharing with the young transgenders, and there are a young group of young transgenders in the Bronx also. But while the test is cooking, I answer the questions, and I look at when the last risk was. So say you were here with me and we were doing a test now, I would probably say today being December 2nd, when was the last time you had unprotected sex? And if that was, say, 4th of July, it's more than 3 months ago. So if you hadn't done anything else to put yourself at risk since then, and this test tests negative, you would be negative.
Okay. And can you comment on the latest CDC statistics?
The last CDC studies, which is interesting, what they were thinking was every year in the United States there were approximately 40,000 new infections. But last year they realized that that number was a bit low, and it is approximately 56,300 new infections each year, and about a third of those are in people under the age of 25. And what is also disturbing is about a quarter of those people don't know that they are infected and have AIDS, a concurrent AIDS diagnosis at the same time.
Are things getting worse or better?
Well, the information and the education is getting better. But when we take into account other factors such as homelessness in teens, sexuality, LGBT community, there's a lot of homeless teens in that community. There's a lot of foster care families. A lot of kids age out of foster care at the age of 21 and they don't have anywhere to go. So these are the populations that we do see growing numbers of HIV infection in, and especially young men who have sex with men.
Now, it seems that youth is reaching out on Facebook, Twitter, and MySpace. Do you think that is a positive outreach?
It's positive and it's also negative, because I do learn from a lot of young men who have sex with men that there is a lot of sexual activity and cruising for sex on the internet and just hookups as opposed to relationships. So there is a lot of anonymous sex through the Facebook and those media and social networking.
And now, youth goes out for a couple of drinks at a party. They have unprotected sex. Why do you think some of the reasons why they don't use a condom? Do you think they're afraid to ask for condoms or reach out to their parents?
Well, there's not a lot of discussion with parents and children about condoms. Have you had a conversation with your parents, thinking back to when you were about 16 or 17, which is a shorter time travel trip for you than me, you know, but I can't see where you would have had that conversation.
Right.
We don't have that dialogue with our parents. But the schools are available. There are a lot of youth-friendly programs. It's just that the face of HIV and AIDS doesn't look as scary or as death-threatening as it used to.
Yeah.
So people are treating it, as I said earlier, as a chronic illness. You don't see people with this mask of despair anymore. So and young people, especially adolescents, have a sense of invincibility. And nothing's going to happen to them.
That's true.
So.
And some, you know, some teens and adolescents feel that being in love makes them immune. Have you ever heard that before?
Right, he loves me or I love him.
Yeah.
Or what I hear a lot of it, which is also unfortunate, especially with young women, they'll tell me that my boyfriend just came home from jail, so I know he's clean, because they get tested in jail.
Right.
So.
And some people born with HIV conceal that from their partner, and this can also be one of the factors that are contributing the rise.
Well, it's not so much concealing, it's disclosure. And disclosure, where you have to think about it, where do you make disclosure in relationships? It's not like, hi, my name is Pat and I'm 16 and I was born with HIV. Please be my friend. So you have to develop a relationship and some sort of trust with a person before you would share something that devastating with them. Young people, whether they were born with the virus or behaviorally infected, have to realize, you know, that it is part of their responsibility to talk about it, but it's also the other person's responsibility to protect themselves and ask questions also.
Now, if you could deliver a message to our politicians in terms of health care reform, what would you tell them?
That we still need to up the ante. Programs like mine definitely need to be more visible. I'm at a good place with Montefiore Medical Center and Children's Hospital because we are grant funded, so I'm able to talk about things that the Board of Education can't talk about. Teachers can't, and the Board of Education can't talk about with their students. I can give out free condoms because I'm grant funded, and I do have monies coming in for that. I'm also grant funded to do HIV rapid testing. I have free kits. So there are not a lot of programs like that, and funding is being cut back across the board, you know, from the government,
right.
city.
And speaking of funding, they say that poverty is a major factor for people who have HIV and AIDS. Do you think they become poverty-stricken when they get the virus?
No, I think being impoverished is part of a factor that may lead one to be more at risk for HIV because of the choices that they make in their daily lives. When you think about it, it's freezing outside today. Now, if you're homeless and someone is offering you a cup of coffee and a place to stay tonight, if you don't use a condom, what's going to happen?
Right, but does having AIDS make you poor? Because
no, you're poor anyway.
Okay, yeah.
Having AIDS, there are so many medical benefits available. I mean, there's housing, there's full medical care, there's psychosocial care. So a person who has HIV infection is monitored, and if and when they do become and have a clinical AIDS diagnosis, because it is just a diagnosis. There are additional financial assets and benefits out there for them.
Where should these people go to find out what those benefits are? Some people with HIV don't know how much they can receive.
They can go to city hospitals. Montefiore is a private hospital, but we have a large adult HIV clinic as well as the adolescent program where I work. All city hospitals have HIV and AIDS clinics, and we're lucky in that aspect if you live in New York, because the AIDS Drugs Assistance Program is for the uninsured, is doing really well, whereas in some other states there is a waiting list if you do have an HIV infection or AIDS to get medications.
Right.
So if you're uninsured in New York, there are ways to get insurance.
And earlier you mentioned about free condoms, and they're in, you know, your doctor's office or in clinics, but teenagers don't want to take them. Why do you think that is?
Well, I beg to
fear?
differ, really. They do take them.
They do, okay.
They do. There are certain types of condoms that are more popular, just like the Timberland boot might be more popular than a Payless boot or something like that. There are certain condoms, they like the Rough Riders, the Big Mac, different kinds. But if those condoms are offered, they usually take them.
We're almost out of time, so how can someone get in touch with you?
Well, my name is Pat Harriet Jackson, and I'm at the Children's Hospital. It's pharriet@montefiore.org. My phone number is 718-882-0232.